Good morning, Mr. Coon.
How you doing, sir?
I am Dr. Lukos. I'm your medicine doctor today. I know you got admitted early morning today. So we are here rounding with the team. Your bedside nurse is Anesa, and we have the clinical leader, Tiffany, here.
How you doing?
So I'm just going to go through what has been going on, and just let me know if you have any questions in that part. So I understand that you stepped on a nail a few days ago, and it started to bleed a little bit, and then it got a little painful, and eventually you got fever, and that's when you decided to come in. Is that right?
Yes.
Okay. And does it hurt now?
No.
Okay. So when you came in, we did a X-ray, which was concerning for some like swelling. Your blood work was concerning for some infection as well. So we started you on some lots of fluid because you were sepsis alerted, which means that you have pretty bad infection. So we started you on some fluids, started you on some broad spectrum antibiotics after taking the cultures. So for now, our plan will be to continue the antibiotics, continue the fluids, do some blood work daily, and see how you do clinically. Probably we'll have to do further imaging of the foot. It depends upon other labs and all. Okay. I know you are in pain. The nurse told me about it, so I have added some pain medications for you. She's gonna get to you as soon as we are done rounding. Okay. Any questions for me?
No, sir.
All right. So I'm gonna ask Anesa, the nurse, to give her input on you. Okay. Is that okay? All right, Anesa.
Okay, so he has a peripheral IV in the right arm. It is 3 days old. He is voiding without problems. I dumped 400 cc's of urine this morning.
Okay.
I don't think a Foley will be needed. He is on a cardiac low carbohydrate diet and was MPO yesterday as a result of being septic.
Okay.
He is eager to eat this morning. He
Okay.
needs assistance when ambulating because of the BKA,
Yeah,
but he also
yeah.
has a right foot wound.
Okay. So can we please make sure that he sits at the chair for his meals and at least 3 times a day ambulation,
Sure.
so that he will not get deconditioned more.
Okay. His last bowel movement was 4 days ago, but we're continuing his Colace and his Metamucil.
Okay. Very good.
We've also been following his vital signs Q4, and he is on telemetry.
Okay. So now he's no longer septic. So do you think we can tune it down to like every 8 hours vital signs? What do you think?
Yeah, I think that would be a good idea.
Okay.
And possibly discontinue his tele.
Yeah, absolutely. Yeah, he doesn't have any arrhythmia that we saw in the past 24 hours, so I think we can discontinue that.
Okay. Also, his basic metabolic panel has been stable.
Okay.
Can we decrease his blood testing to once per day?
Yeah. I think that's reasonable. So yeah, once a day. I can stop every 8 hours to once a day. That'll be appropriate.
Okay.
Yeah, he's not getting more septic, so that's good.
So his pain is now well controlled on the Percocet that you recently ordered.
Okay. All right, that's perfect. So do you have any questions about the plan for the day?
No, I think the plan seemed to be clear.
Okay.
To sure we're all on the same page, Tiffany, do you mind writing down on the board before we go?
Okay, let's go over the plan first. We're continuing antibiotics.
Yes, so we are continuing the cefepime and flagyl. We'll also continue the IV fluids. Most importantly, we'll control the pain really well. He probably will need an MRI. We'll follow on the blood cultures and bone cultures, and probably discharge in about 3 days. All right, perfect. Thank you, everyone.
Thank you.